Hey, angels, it is Lizzie and Samantha here.
How's everybody doing?
We are bringing you a very advanced technique for estheticians doing dermaplane. So, we have a couple things we want to talk about. One mainly being how to keep your room clean to do these type of techniques, and also how to make sure your patient is nice and clean. So I'm going to have Sam talk about what she does to prep the patient's skin. And then in some of this video, you're going to see some advanced techniques such as like a lancet where she's going to be popping out a whitehead, which was on my face. You're welcome.
Thank you.
Yeah. So we're going to talk about some more advanced techniques for you guys.
So I'm sure, as far as keeping your room clean, it's pretty basic. You want to make sure that you're disinfecting well. Anything that you touch with your hands, your light, your mag lamp, your steamer, your bottles of product, your sunscreen, where you put your products, if you have like a little tray, you want to make sure that, and it's one of those rolly ones because that's what I have. Make sure that you're cleaning the top of it and the bottom of it and all around. You need to make sure you're doing all of that because you're touching it on the bottom too. So you want to make sure all that is clean because you're opening up the skin, you're exposing new skin cells. You don't want to expose anything to that skin. So if you're touching things and then you're touching their face, that's not necessarily what we want to do. We don't want to introduce anything that shouldn't be introduced into the skin. So very important.
Yes. So what do you do to prep your patient, their face, like mine, for instance? What did you do to make sure I was super clean and ready for extractions?
So really good cleansing is important. Don't be afraid to double cleanse, especially if your patient is wearing a full face of makeup. You want to make sure that you're double cleansing and getting all of that off. And sometimes you can't get everything, especially if people have like spray tan and things like that. You can't avoid that, but you can just get it as squeaky clean as possible before you start working on that skin. I make sure I don't do any exfoliating before because I don't want to overly sensitize the skin. And then I will proceed with putting a Dermaplane oil on the skin all over. I even do it for my oily patients because I feel like it just keeps everyone comfortable. And when I'm done, I'm cleansing the face again anyway with a gentle cleanser because I want to get all that oil off.
And as far as like home care for someone that gets a lancet or some heavy extractions, what do you give them as far as product and their regimen for the next, few days?
So normally, honestly, I don't do very many extractions on new patients, even if they have a lot of breakouts, even if they have a lot of blackheads. I don't want to be too harsh on them or rough on them and give them a bad experience and then they don't want to come back. So I'm very gentle. I do not use any metal, anything on their face when I am doing extractions. I quit doing that a long time ago. There's too many factors with it that I noticed, especially in darker skin types. You can cause pigment. Yeah. You can,
those extraction tools.
You can be too rough on people, so I do not use them anymore. And you'll see what I use later on in this video. But you just want to make sure that you're not being too rough. Again, I don't do it initially out the gate with a new patient. I want to make sure they're getting on good skincare. And when I say good skincare, I'm talking about medical grade. Anytime you hear me say that, I am not speaking in terms of over-the-counter skincare because I've never found anything over-the-counter that really changes my patients and my own skin significantly or even long-term. I've not found anything that does that over-the-counter. So medical grade is what I'm talking in terms of when you hear me say that. So I want them on better skincare because I know if they do just a basic, even just a cleanser and an exfoliator, if they come back to me in 4 weeks, they're going to have less. They're going to have less breakouts. They're going to have less blackheads. That skincare is already working on loosening things up and getting things to come out on their own. And then I will do more extractions here and there because it's going to come out easily. You should not be beating people up. You should not keep going until something happens just because you want to get an extraction. Absolutely not. If it is, stubborn and it does not want to go, you leave it alone. Let it stay. You're going to give them skincare. They're going to treat their skin, and that's going to help get it better. And next time they come in, it might be gone completely, that area that you were trying to extract, or it'll be loosened up and it'll be easy for you to extract that area.
Look at that.
Yeah, so these are milia. She can get milia once in a while. Most of us can. So I did use a lancet, and here in Florida, estheticians I don't think are able to do that. But I have different licensing that I have on top of that for laser and electrolysis. So sometimes I can do a little bit more, but sometimes I don't even like. I think there was that one I didn't even use a lancet, did I? I think I just tweezed it out with those needle nose tweezers, and it just popped right out.
Yeah, that's so cool.
Yeah, with lancets, that's a really advanced technique. That's not something you want to do out of the gate either. You need to really be studying on that and studying, anatomy in the skin and how the skin heals, and be familiar with your patient's skin and how their healing process works.
Well, and you also worked at a spa that had dermatologists and things like that, so you were trained properly.
Yes, I did. I did, and we had plastic surgeons. Yeah, there we go.
So don't try this at home, especially if you don't have a physician that is over your spa or your clinic. You need to make sure you have, if anything is to go awry, you have someone here to help.
Absolutely. I like using, they're not really Q-tips. I think they call them applicators, because they have the wood handles, so they don't bend when I do extractions. So I really like using those. And again, I'm trying to have a nice gentle touch. I'm not trying to beat my patient up. I don't want to cause any more discomfort. That was a really good whitehead.
Yeah, it was. Thank you so much for getting that out.
That was awesome.
Sometimes I don't see those. Yeah. I mean, even though I look at my skin every day. So.
You have a young child at home. How do you have time to look at your skin or touch it?
I don't even have time to wash my face, but it's fine.
Yeah, and you see how she's kind of red over her cheeks?
Yeah.
I'm familiar with her skin. I know that she does that, so that doesn't necessarily worry me. But I do know what to send her home with, and she knows what to use to keep that skin comfortable after she has her treatment. You need to make sure that your patients know exactly how to take care of their skin.
Yeah.
I don't necessarily combine treatments either right away. I do not do masks on them when I do Dermaplane. I don't do microneedling on them after I do Dermaplane. I don't do anything else after Dermaplane, especially if it's a new to me patient. I want to see how their skin does. When they come back in a couple weeks for another treatment, I ask them, how was your skin after your Dermaplane? Did you have any issues? Were you sensitive? How long were you sensitive? Were you red? I asked them a million questions to make sure that they were okay. And then maybe I might add in a Diamond Glow or a Hydrofacial. It depends. Sometimes I will do Dermaplane the first time. Second time I'll do the Diamond Glow or the Hydrofacial by itself. That way I know how their skin reacts to each treatment that I do alone before I combine them. It just depends on the skin type. So you just want to make sure that you anticipate reactions so that you know how to respond and you know how to take care of your patient.
Love it. That's it for us today, guys. Thank you so much for watching. Please subscribe to our channel, and we will see you next time.
Bye.
Bye.